Hey, what's up guys? It's Carson and today is June 4th, 2021 and that makes me 3 months post-op top surgery. So today I'm going to go ahead and do just a little bit of an update on what my top surgery looks like, what I'm thinking about it, how I'm taking care of it, and just general things like that. I was originally going to do a monthly update on these, but at 4 weeks you're still completely covered up. I wasn't cleared to take off my binder or anything until 6 weeks, and that seemed like a really odd time to make an update. Honestly, not a lot has happened from 6 weeks till now anyway, so I think I'm just going to end up doing these every 3 months, so 3, 6, 9, and 12. I do want to say ahead of time, because I like to be completely honest with myself and with my viewers, that I'm actually not 100% happy with my top surgery. I'm like 85-90% happy with my top surgery results, and I'll go ahead and talk about why I'm not in a second. There's really just like one thing about it that I don't like, and I don't see a lot of other guys that have this. I've seen a lot of guys that have had it, because I've gotten in some Facebook groups, some Reddit groups that I've shown pictures of, and people have told me like at 3 to 4 months is usually when that will start to go away. I still kind of have it though, so if it's not gone by 6 months, I really just don't think it will go away, and I'll probably end up having to get a revision. I still am really happy with my surgeon. I would pick her again. I really do like my scar placement. I think she did a really good job of making them go right along with the pec muscles. Aesthetic wise, that's exactly what I wanted. I really like that. There's just one small defect that I don't necessarily think she had a lot of control over, and that's the only thing I'm just like not super happy with. So I'll go ahead and I will take off my shirt so that you can see my results, and we'll get right into what I think. Alright, so this is my chest at 3 months post-op. Now, from this far away, I don't even really know that you can see the defect, and here's the thing, I'm probably a lot more judgmental of myself than other people, so some people might even be like, dude, that's not that noticeable, but to me it is, and it's bad enough to where like I definitely will want it fixed, especially because I haven't actually gotten a bill for top surgery yet, but I still think I'm going to end up paying like a decent amount. I mean, I've already paid like $3,000 out of pocket, so if I'm going to pay that much money, I want it to be like as perfect as it can be, and it's pretty close, but yeah, so I don't know. There's, one thing I do want to fix. So like I said, I really do like the scar shape. I think they're really perfect with the pec muscles. If I build any muscle, which I'm getting more muscular, I think that could end up getting a little bit hidden underneath the pec muscle, but I'm not really that muscular, and this is the most I've ever had, and I'm finally starting to see some results, but I don't know if I'm ever going to get like actual pec muscles. For scar treatment, the only thing that I do, so I didn't start scar treatment until 7 weeks. From 6 weeks to 7 weeks, I just did nothing, kind of left them naked, let them like air out, just whatever. I didn't do anything. At 7 weeks, I started doing scar treatment, and every morning I put on bio oil and massage it. They actually might be like a little bit oily right now because I already did it, so if I look like oily, that's why, because I have bio oil on. And then at night, I either do scar gel or scar strips, and when I put the scar strips on, I usually try to pull like the skin a little bit tighter through here, because this is where I don't like my chest. I still don't know if you could see it, but I will get a little bit closer in a minute and show what I don't like. I think my nipples look great. I can't feel them at all, which is super weird because I have gotten a lot of like ingrown hairs in them, which is odd to me because I don't really think that like you get hairs like here. And it's weird because I'll look down and I'll kind of like see it, but I can't feel it, and it's interesting. But that is something that like I've had kind of a little bit of. I will say overall, like my chest and back acne has gone down a lot, and I think that's because I'm not having to wear like a compression binder all the time. So that's been great, and I just feel like way more confident wearing like smaller, tighter clothes. So a pro and a con, or a positive and a negative, is that I've actually gone down a shirt size. I actually don't think I really went down a shirt size. I always think I've been a small, but because I was super self-conscious of my chest, I always wore a medium, and I think a lot of trans guys do that. We want to wear like baggier shirts to hide our chest, so I always wear mediums. And now, like, some of my mediums look fine on me, but a lot of them, they just look ridiculously big. They just look way too baggy, and they make me look bigger than I am. Like, especially like through the hip area, and like the shoulder seams just sit too low, and they look way too long. And like in some aspects, oversized shirts are in, and I don't mind like a little bit of an oversized look, but some of them, they kind of swallow me and they look ridiculous. So I'm essentially gonna have to like redo my entire wardrobe. I've started just slowly buying some smalls. Because I have a lot of t-shirts, so like I am essentially having to almost do a whole entire new wardrobe. I also kind of have gone down a pant size, so I did get hip liposuction. I'll show that in a minute too. I'm still a little bit swollen. I probably should wear my compression more to like help absorb the lymphatic fluid that is still on my hips. But I always was a 30-30 in jeans, but I always wore a belt. And she told me I probably shouldn't be wearing a belt right now because it could like constrict the fluid. Kind of makes sense. So I went down to a 29, and even a 29 still can like kind of fall off me without a belt, but a 28 is just too tight. So like I've been wearing a 29 right now. So yeah, have to pretty much completely redo my entire wardrobe, which is like good and bad. Good because I'm smaller, but bad because that's a lot of money. And like, I mean, I'm gonna donate all my clothes, but man, I already spend a lot of money on clothes. So yeah. All right, so I'm going to get a little bit closer now so that you guys can see a little bit closer of my chest, and so you can see the one defect that I'm like just not like super happy with. And then if anybody has any advice on like maybe things that I could do to get rid of it, that'd be great. Otherwise, I don't know, I guess time will just tell. So, all right, let's get a little bit closer. All right, so here is a close-up of my chest, and now that I'm a little bit closer to the viewfinder, I think you can kind of see what I'm talking about. So, the one thing I don't really like about my chest is these marks right here, which they are stretch marks. At my 6-week post-op appointment, I brought this up to my doctor and I said, hey, like, do you think that these marks will go away? Because I don't like them. And she basically said that they're stretch marks and that they could go away, they might not go away. There's really just no way to tell. And she said the only way she could have fixed it is if she did a line completely across, and that she's not a big fan of how that looks. I'm also not a big fan of how that looks. I like the scars. But the one thing I think is weird is that I actually have stretch marks literally everywhere, and they're easier to see if I like hold up like this. But like, I did have a lot of stretch marks, but these are like indented into the skin. But for some reason, these ones are like more bulging outward. They're kind of swollen-ish. I don't know. I just don't understand why they only did that here and not everywhere else. I do think it's a decently easy fix if I have to get a revision. Literally just like pulling the skin tighter, which my skin's oily right now, so it's kind of hard to do that. But if I pull the skin tighter, they go away. Because like they're literally kind of like bulging outward. So pulling the skin tighter kind of makes them not bulge out, I guess. So I would think if I have to get a revision, probably could just like hopefully recut into the incision, maybe like this far on each side, and then just like take that skin and pull it tighter and restitch it, which is kind of how she described a little bit on how I think that would work. But I really don't want to have to go under again if I don't have to. So honestly, I'm just kind of hoping that those will smooth out on their own. Like I've been putting a lot of oil on it, putting the scar gel and stuff on them, but I have no idea why only through here did they bulge, nowhere else. Yeah, I don't like it. It's the only thing I notice when I look in the mirror, and I think a lot of other people would be like, they're not that noticeable, but to me, they are, but you're also the most judgmental of yourself, so yeah, I'm not super happy with that, but like, if I really pull the skin back, like, it looks a lot better. So, maybe if I even build some pec muscle, those would go away, but I don't want to feel like I have to be the one to get away from that, I guess, if that makes sense. I don't know. I would just, hopefully they'll either naturally go away on their own, or I'm going to have to get a revision. So, and then I will back the camera up a little bit. And then, so for like hips, this is a little bit tighter of a pair of underwear, so it kind of like makes those bulge out a little bit more. But yeah, if I wear a medium, that doesn't do that as much, and I have jeans on. But the liposuction spots are getting pretty faded. I mean, I can still see them, but they don't really bother me. But I am still a little bit swollen, and mostly how I can tell, I don't know that other people can really tell, but fat is like, it's very squishy, and it goes back. And with the swelling, it's actually like more of a hardness. It feels hard under there. But that's the only way I can really tell. And like sometimes when I look at my liposuction, I think, I don't really know if it looks that different from before. But I've looked at pictures and I'm like, actually, no, it looks way different. And it should still continue to go down even more. But like I said, I probably should sleep still in my compression, which I stopped wearing at 6 weeks. I mean, she told me I could, but I think it will help with this lymphatic swelling a little bit. And then I am trying to bulk out just a little bit here. But overall, I mean, yeah, I'm still a little bit curvy, but I don't think it doesn't look that bad. I look a lot better than I did before top surgery, or at least I think so. I really like my body now, so yeah. Alright, so yeah, like I said, this is my 3-month post-op top surgery results. I'm pretty happy with them. Like, I don't want to sound like I don't like my surgery. Like, I do. I just really don't like that, like, little tiny defect. Like I said, hopefully it'll go away. If not, I guess I'll probably have to get a revision because it's important to me to smooth that out as much as possible. So I will update you guys again probably in 3 months. Hopefully at 6 months that's gone. If not, like, I'm already starting to prepare myself for like having to go under again, which sucks because I'm really getting into working out now and I don't want to have to take another 6 weeks off and not work out and just like, yeah, I don't want to have to go under if I don't have to. So like, yeah. But anyway, I'll update you guys again in 3 months. Thanks for watching the video and I'll see you guys later.